Now, what are the signs of kidney disease? Unfortunately, most of the time, the kidney disease is a silent disease. Just like high blood pressure is a silent disease, and hence called a silent killer, so is chronic kidney disease. It's very silent. You may feel nothing until when the kidneys are very much, the function is very much reduced. And what are the signs at that time when you have what's called stage 4 or stage 5, when the kidneys are almost totally gone? You can have different kind of signs and symptoms, which include extreme tiredness. You suddenly feel tired, fatigued, no appetite, nausea, vomiting, confusion, trouble in concentration. You might find you have also getting cramps of the body. You also may find swelling of the body, and you'll be finding yourself sometimes having an itchy skin because the toxins are accumulated in the body. And sometimes you might also find that you start going to the toilet, especially at night, more frequently. These are the signs, warning signs of kidney failure, but when they're at a very late stage. So we need to be able to understand who's at risk of developing chronic kidney disease. There are several risk factors, and anybody with these kind of medical conditions, then it's important that you be able to go to the hospital to be assessed. What are these conditions? The number one condition in the world which causes chronic kidney disease is diabetes. And we know that diabetes is increasing and doubling very fast. Expected to reach almost 1 billion by 2050. The more diabetes increases, the more the chances of chronic kidney disease also increasing. Mind you, in 2017, already chronic disease patients were double that of diabetes. Can you imagine when there is 1 billion diabetes patients, how many people will be having chronic kidney disease? That said and done, another risk factor for it is high blood pressure, with the second common cause of chronic kidney disease. If you have a hypertension, family history of hypertension, or diabetes, then be sure you make an effort to check your kidneys frequently. Another risk factor, anybody who's more than 60 years of age, you've got a higher risk of developing chronic kidney disease. Smoking, which is very rampant, and we know what's happening around. People use smoking for releasing stress, but it's very harmful. It's a very high risk for causing chronic kidney disease. Obesity, we are an epidemic of obesity. There's something called diabesity, where diabetic patients have a large amount of obesity. Obesity does not affect only the rich or the poor. It affects everybody. And increase obesity, there's increased risk of chronic kidney disease. Family history. If you have a family history of chronic kidney disease, or family history of diabetes, hypertension, then also you're at a high risk of developing chronic kidney disease. Heart disease. If you have a heart disease, that also is a risk factor for developing chronic kidney disease. So if anyone with this history of diabetes, hypertension, age more than 60, smoking, obesity, heart diseases, or family history of any of these conditions or chronic kidney diseases, then it is important and paramount to be able to make an effort to check your kidney function before it is totally damaged, before the signs we talked about earlier.